what is the ramp? There's something that everyone talks about, but do we really know what it is? That's a really nice cartoon that was lent to me by one of my colleagues, Mathieu Olivier. And this nicely demonstrates the back of the tibia, you've got the medial meniscus, and then you've got the meniscotibial ligament along with the capsular attachment. And it is intimately associated with the semimembranosus bursa. And you can see on this diagram here, one of the papers by Cavagnac et al., showing the areas that the medial meniscus attaches to, including the meniscocapsular ligament, the meniscotibial ligament, and the posterior capsule. And you can see the meniscocapsular ligament eventually becomes part of the posterior capsule. So getting an understanding of the anatomy is really important. Of course, there's a classification system. There's tears that are complete tears of the ramp. There are some that are quite, you may even consider as red on white tears of the medial meniscus, and some that are behind the meniscus that you may not see at the superior surface. So this is mostly for scientific purposes. When you're looking at your scans, do look for them on the sagittal views of the knee joint. And if you look carefully, you can often pick them up. So this is a sagittal view on the medial side of the knee. You can see the semimembranosus is quite close to where we'd normally see a ramp tear. And you can see just behind the medial meniscus a vertical line demonstrating where the tear is. So just at the back here. Next time you do a knee arthroscopy, attempt to go into the back of the knee joint. So it's just slipping underneath the posterior cruciate ligament. You need to be able to maneuver your scope. You may not necessarily see something from the front, and you can see on the video on the left here, actually there's very little movement of that medial meniscus. But if you go into the back, you can see, just to orientate yourselves, this is the back of the medial meniscus, this is the posterior medial portal, and the ramp tear is just in the back over here. So do practice having a look. Once you get accustomed to doing posterior medial approaches, posterior medial viewing, if you're able to put your camera into the back, you can see the back of the tibia here nicely. This is the ramp tear at the back here, and as you go into flexion and extension, that ramp opens up. So do try and get used to looking at the back of the knee. We're getting better and better with our approaches on how to look through the knee joint. The transeptal approach was not something that I got taught during my training, and I still think it's not something we routinely do. But if you want to have a really good look at the back of the knee, whether you're doing PCL surgery, like Rahul was talking about earlier, or ramp repairs, this can be a really nice way of looking at the back of the knee. But actually, to start off, do the simple things first. Go look through the front, go underneath the PCL, and make sure that you can see the back. And you should be able to get a view like so. So the intercondylar portal allows you to look at the posterior third, but you can look across the whole of the back of the tibia with the transeptal approach. And indeed, if you make a second posterior medial portal, which is slightly higher than the one that you're using for your ramp repair, you can also get a really good view.